of Jinja School of Nursing and Midwifery. I'm really happy because whenever I come, there are reasons. One, whenever I come around this place, there is always something new. And a new something better and something that improves the standards of our institutions. Thank you very much for inviting me. Thank you very much for the warm welcome I received when I arrived in the morning. As I said, I love your dancing. I like the Kisoka dancing. I enjoyed the parade. And most importantly, I loved the fact that whatever little resource that are given to the institutions, I noted is being properly utilized. Bali mukubire koko headmistress principal mungalo ez'amaanyi. Many people are given money, but after a year, you wonder what that money has done. I think we gave them 1 point something billion. Before you leave, my dear parents, go and pay visit and see what they have been able to do with that money. I want to thank you at least for that and all the others. I want to thank you for collecting all these principles. I like that collaboration, that cooperation. They are not competing. I've been hearing institutions castigating each other, but the way so many of these have been able to, so many of these traveling all the way from wherever they stay to come over and preside and be part of this function, it means a lot to the administration, to the leadership of this place. I want to thank you for it, and please let everybody copy from that. My dear graduates and friends, I brought you very warm greetings from Mama Janet Kataha Museveni, who happens to be the Minister of Education and Sports. He loves you and he conveys very warm greetings and a lot of messages of congratulations. As your minister in charge, I'm very happy to witness the graduation of 710 nurses and midwives. And these are joining the pool of skilled health professionals to support the delivery of health services in the country and beyond. Here beyond, I think I'm thinking about exporting some of those skills to where there is more money. The addition of these professionals to the health workforce will go a long way toward the fulfillment of commitments made under the NRM manifesto, under the development plan, national development plan. So, and by the way, you know that training, passing out nurses and midwives at diploma and certificate level is not a minor achievement. Indeed, we need to celebrate today. It means quite a lot. First of all, it is very expensive to train such cadre, very expensive. It requires a lot of money. As you may have seen, those of you who accompanied me to tour the Skills Lab, it requires a lot of time, and I thank God for what we have achieved today. It means out of a cadre, we have been able to push to the public people who are going to be responsible for providing medical, surgical, pediatric, community, mental, rehabilitative, and midwifery services to Ugandans. Uganda, like many other developing countries, has a limited skilled human resource, almost in every sector. This challenge is even worse in the health sector, despite having a serious disease burden amidst a fast-growing population. You are very much aware that our population is growing at a rate of 3.2%, and yet the Ugandan ratio of health worker per population is still very bad. We still have very few nurses and midwives who are required to serve each doctor. and of course, there are also few doctors available for the population. It is therefore